Arthritis is the #1 reason people apply for disability, and it's the #1 condition I see when I do Social Security disability exams. If you have arthritis and are applying for disability, this information will be important for you. Hello, I'm John Foster, and I'm a medical doctor who does Social Security disability exams. I've done over 1,500. Arthritis is a broad topic, and I'm going to split my arthritis talk into two pieces. Today, I'm going to talk about what arthritis is and the three most common types of arthritis, which comprise about 95% of the arthritis cases I see when I do disability exams. As usual, everything I say reflects my own opinions based on my own experience and study, and not the opinions of the Social Security Administration or any other medical body. Now, the word arthritis simply means joint inflammation. I talked about inflammation in my most recent video, and you might want to watch it. Basically, inflammation is the body's reaction to something it doesn't like. That could be a germ, that could be a splinter, it could be all sorts of things. There are 4 features of arthritis, which are swelling, warmth, redness, and tenderness. If you've ever looked in the mirror when you had a sore throat, you would have seen inflammation in your throat. It would have been red and swollen, and it would have been painful, although you probably didn't feel the temperature. Now, I'm going to try and use as much layman's language as possible, but I'm going to have to use some medical terms. And to help the non-medical viewers, I'm going to list each medical term in the description of the video below and explain what it means. Arthritis means there is inflammation in the joints. It's different from arthralgia. Arthralgia means painful joints. There can be all sorts of causes for painful joints. Arthritis is one. There must be signs of inflammation for the diagnosis of arthritis to be correct. Joints are basically composed of 4 different things. The first are the bones. The second is cartilage. Cartilage is a very smooth plastic Teflon-like material that coats the bones, that allows them to glide smoothly against each other. If you've ever taken the meat off a chicken drumstick and seen that shiny, whitish, silvery stuff on the top, that's cartilage. There is also synovial fluid, which is the fluid inside the joint. Each joint has a small amount of synovial fluid, and I tell patients it's like joint grease. It helps to lubricate the joint. There is also the perisynovial tissue, also called synovium, which is the soft tissue that surrounds the joint. In all forms of arthritis, that nice, smooth, gliding cartilage is damaged, becoming rough, irregular, like sandpaper or grit, and no longer glides smoothly. Also, the nice lubricating synovial fluid either becomes like water and loses its lubricating ability, or becomes like pus, or even gets full of little tiny needles. There are secondary changes to the bones, and also the soft tissue around the joint may become inflamed. Another thing to know about arthritis is that the different types affect different joints. Only one joint may be affected, which is called monoarticular. Only a few, like 2 or 3 joints may be affected, which is called oligoarticular. Or many joints may be affected, which is called polyarticular. Also, arthritis may be asymmetrical, only present on one side of the body, or symmetrical, present on both sides of the body in the same joints. So now that you have an idea of what arthritis is, I'm going to talk about 3 common types of arthritis that I see for disability claims. By far, the most common is what is known as osteoarthritis. That probably represents between 80 to 90% of the arthritis patients I see. Osteoarthritis is what you get when you get old. The cartilage breaks down in the joints. The synovial fluid loses its greasiness and becomes like water and doesn't lubricate very well. Osteoarthritis is associated with the formation of bone spurs, which doctors call osteophytes. Osteoarthritis comes on gradually over years and gradually gets worse with time. There is minimal inflammation with osteoarthritis. Joint redness and heat is rare. The joints that osteoarthritis tends to attack are, first of all, some of the joints in the hands. Osteoarthritis will affect the distal knuckle, called the DIP joint, the proximal knuckle, called the PIP joint, and often the base of the thumb. It does not affect these knuckles, known as the MCP joints. Osteoarthritis also commonly affects the spine, the low back, number 1, the neck, number 2, and the hips and knees, but not the ankles or feet. Osteoarthritis also tends to be symmetrical. For example, if someone has osteoarthritis in one knee, they almost always have it in the other knee as well. Osteoarthritis causes bony swelling, which is hard when you feel it, and pain and joint stiffness. The stiffness tends to be worse when you get up in the morning, and the pain tends to increase with use. For example, people with osteoarthritis in the fingers, their fingers will hurt more the more they grasp or manipulate things. Because of pain, patients may stop using an arm or a leg and get secondary weakness because they're not using the arm or the leg, the muscles shrink and become weak. Factors that predispose people to osteoarthritis are older age, genetics, being overweight, which affects the hips and knees, and heavy work throughout the lifetime, such as construction workers or pipe fitters. Osteoarthritis only affects the joints. The rest of the body is not affected. So there are never what doctors call systemic effects, which means effects throughout the body. There is never fever, never weight loss, and never fatigue. Likewise, all blood tests are normal, and urine tests are normal. Tests for inflammation are negative. Doctors may do a test where they put a needle in the joint and suck out some of that synovial fluid. That's called a joint aspiration. In osteoarthritis, because there's not much inflammation, the synovial fluid will be pretty normal. In osteoarthritis, a joint aspiration is most common in the knee because some patients with osteoarthritis get what layman people call water on the knee. Doctors call a joint effusion, which is where the knee swells up like a water balloon because of overproduction of synovial fluid. Next, I'm going to talk about 2 types of arthritis where inflammation is much more severe. Those are gout and rheumatoid arthritis. But first I need to talk a little bit about tests for inflammation. There are several tests for inflammation in the body. They're what's known as nonspecific tests. The inflammation could be caused by anything. For example, pneumonia or COVID-19, but also in cases of inflammatory arthritis. The symptoms of inflammation in the body are fever, feeling bad, like you're sick, feeling fatigued, losing weight, and then abnormal blood and urine tests. The two general tests for inflammation in the blood are what's known as the erythrocyte sedimentation rate, or ESR, which goes high in inflammation, and the C-reactive protein, or CRP, which also becomes high if there's inflammation in the body. Also, in the blood, with inflammation in the body of any cause, there will be an increase in the white blood cell count, or leukocyte count. In the urine, there will be protein in the urine. In a normal person, there's a teeny tiny amount of protein in the urine, almost unmeasurable. But in inflammation in the body, there can be large amounts of protein in the urine. Again, these tests can be positive no matter what the cause of inflammation, such as infection, arthritis, or some types of cancer. In the synovial fluid, if there's a lot of inflammation, there will be white cells in the synovial fluid, and it will become like pus. Pus is body fluid with a large amount of white cells. So, on to gout. Gout is a very inflamed arthritis. It's caused by overproduction of a chemical called uric acid by the body, which is pretty complex, and I'm not going to get into how that happens. What happens in gout is that tiny little crystals of uric acid suddenly form in a joint. They're microscopic, but if you look at them under the microscope, they look like little needles. So the patient goes from being fine to overnight having 1 million little needles in their joint, and that hurts like crazy and causes the most intense joint inflammation you'll ever see. Note that gout is not due to age or heavy physical work, although it's more common in men age 50 and 60. Gout tends to come on at night, and it most commonly affects the joint at the base of the big toe. The typical story is a man who went to bed feeling fine and woke up in the morning with a very swollen, red, hot big toe that's so painful that he can't stand on it at all. Gout usually only lasts a few days to 2 weeks, and it comes and goes. If you have enough attacks of gout, it can cause permanent joint damage. It's very different from osteoarthritis, which once it's present, just gradually gets worse and worse and worse over time. Also, unlike osteoarthritis, the person may feel quite sick and have a high fever during an acute attack of gout. As well as the big toe, gout often attacks the heels, knees, wrists, and fingers. Because gout is a systemic or whole body condition, it can also cause other problems outside of the joints. One of those problems is a formation of what we call tophi, which is lumps of uric acid that can form usually in the elbows, sometimes in the hands and wrists and other parts of the body. Also, patients can get kidney stones made up of uric acid crystals. As I mentioned, if a doctor does a joint aspiration, and looks at the synovial fluid of a person with gout, they'll see a bunch of little crystals that look like needles. Finally, rheumatoid arthritis. As I've mentioned in other videos, most patients who come for a disability exam and tell me they have rheumatoid arthritis don't. They either have arthralgias, pain in joints without any evidence of inflammation, or they have osteoarthritis. However, I certainly do see some patients with rheumatoid arthritis. Rheumatoid arthritis is a form of autoimmune arthritis, where the body's immune system attacks and inflames the joints as if they were a germ or something that the body didn't want inside of it. It's an error of the immune system. Rheumatoid arthritis, unlike gout and osteoarthritis, comes on over weeks to months. It almost always affects the hands and wrists, and in the hands it affects these joints, the MCP joints, not so much these joints or the base of the thumb. It's symmetrical. If one hand is affected, the other hand is affected. The patients don't form bone spurs. Their joints swell up, but the swelling is soft and squishy. It's an increase of the synovial tissue, not the bone. The joints are often red and warm, almost always swollen and stiff. However, unlike osteoarthritis, the pain and stiffness tends to improve with use, not get worse. These patients wake up with their hands painful and stiff, but if they get their hands moving, their symptoms get somewhat better. Rheumatoid arthritis is definitely a systemic disease, and patients almost always have whole body symptoms. Rheumatoid arthritis can involve the skin, eyes, lungs, heart, nerves, blood, and kidneys. Patients usually have fatigue and malaise and feel generally sick, sometimes lose weight, and sometimes have a fever, although the fever tends to be low, not the high fever seen in gout. They may get rheumatoid nodules outside of the joints. These are swellings that pop up here and there that are, unlike the hard rock-like tophi of gout, are rubbery. They may also get these rheumatoid nodules in internal organs, and the nodules are due to inflammation. Rheumatoid arthritis always has positive tests for inflammation. There will be positive tests in the blood and usually the urine. If a joint aspiration is done, it will show pus cells. Finally, two more issues: X-rays and joint replacement. In osteoarthritis, the X-rays will show bone spurs. In gout, unless it's long-standing causing joint damage, the X-rays of the bones will be normal. In rheumatoid arthritis, there are what are known as bony erosions. The bones are like punky, rotten wood. They look moth-eaten on X-ray. Osteoarthritis, if severe in the hips and knees, is often treated with joint replacement, artificial hip or knee. And that's usually easy to do because the bones in osteoarthritis are strong and firm and provide a good surface that the artificial joint can be epoxied to. It's rare to have joint replacement in rheumatoid arthritis because the bones are soft and crumbly like rotten wood, and it's very difficult to epoxy an artificial joint to that sort of bone. Well, that's that for this video. In the next video, I'm going to talk about how to present your arthritis case to Social Security and to an examining doctor, because I see patients making a lot of mistakes in those areas. I hope this has been helpful, and as always, remember, if it happens, it's possible.